our main presence today here for the conference pledging Kuwait 3 for the Syrian crisis. Actually, we are proud that we are the major international organization working inside Syria. We actually covered so many dangerous areas. We approached people in need. We conducted so many projects inside to build the capacity of people instead of just wait for the aid from the international community. We are building their capacity in order for them to start work and have their money by themselves, by working for themselves instead of just waiting.
You deal with not only the refugees but also the internally displaced persons.
Yes, the IDPs and the stranded migrant workers who were stranded in the conflict. You know, there's laborers inside Syria. We managed with the Kuwaiti fund last year to transfer more than 350 stranded laborers who were stuck in the middle of this conflict back home safely to their countries. Also, we conducted so many workshops inside the country in order to build the capacity of people on how to rehabilitate the shelters. We actually rehabilitate 11 shelters, you know, to start with the infrastructure, with the medical assessment, health support. Also, we had a program on having for the kids who lost their arms and legs. You know, you can see the pictures here. Also for diabetes and for kidneys failures. I will not, you know, we are not focusing on the number of the fund we were receiving. We are focusing on resilience of the people in need. The whole international community is not only focusing on giving relief or aid. We would like to build capacity of the people, especially inside and outside, to support themselves and support their families. Because it seems there is no near future hope, unfortunately, for this crisis. So instead of just providing aid, we would like to build the capacity of the people in need.
And can you just tell us, does the IOM do work only in the government-controlled areas of Syria, or does it go outside?
No. Actually, we are so proud that our staff in Syria, we have 3 offices, Damascus, Homs, and Latakia. We approach areas nobody else reach there, and under the control of everybody. You know, we would like to work on a low profile because our main goal to reach the people in need and give them the needed support. I don't say that we are always succeed to give the needed support, but at least we reach these people and see, make assessment on the need, try to get fund to give the support later on. Homs also, you know, Homs was of course, and Deir ez-Zor. Deir ez-Zor, one of the areas nobody is going there. We also reach there with our staff inside Syria. Of course, our role is humanitarian, completely humanitarian. We would like to be there only to support the people in need and to try to give them the needed help. It's very dangerous, of course, but somebody has to do it because there's people, you know, there is more than 212,000 people are under siege. They don't have anything. So somebody should and have to support in a way or another. I don't say that we are the heroes. We managed to do everything, but at least we were the first to do this. You know, in any type of crisis, if it's natural crisis or conflict crisis, trafficking is, it will find an excellent soil, you know, to use, and people who abuse and find this is like their best time to get the benefit from this because there is no law, there's no real government everywhere. There's lots of kids actually, you know, who were born and not registered. Unfortunately, they have been trafficked. You know, young girls get married under 13 years old, 12 years old. This is also considered trafficking and also organ selling. This is really, it's a serious issue, and IOM is the only organization who's taking care by spreading the awareness, doing workshops, seminars to, you know, spread the awareness of not to be a victim of trafficking.